Hello guys, welcome back to my channel. Today we will be covering increased intracranial pressure. But before we get to it, make sure to like, share and subscribe to this video so you can be updated on my latest videos. Alright, let's get started. So a quick overview with increase in intracranial pressure. It is a symptom, not a disease. Again, it is a symptom, not a disease, meaning that you will see changes in a person if something is going on with their intracranial pressure or the amount of pressure in their head. Alright, so it can occur from any type of trauma, any head injury, car accident, motor vehicle accident. So anything that can increase anything that can cause damage to the head can cause an increase in the intracranial pressure. Once there is an increase in your intracranial pressure, it can cause impaired perfusion of blood to the brain. It can cause cerebrospinal fluid to also increase in pressure. It can alter the health of cells within the brain, and if it's not treated, if it is left untreated, it can result to death. So increase in intracranial pressure is definitely something that you have to monitor very closely, because it is a critical symptom that the person is going through. Alright, so let's think about it logically. So we know that the cranium, or the skull, is fixed. It is made up of bones, and inside it is the brain. Now there is no room for expansion within that space. Like, it is an enclosed space. So if, for instance, let's use some fluid. It normally holds 10 ml of fluid in an enclosed space that cannot be expanded. If you add 10.1 mLs, and it usually holds 10 ml, it will cause an increase in pressure, because remember, that space is not being expanded. The capacity is 10 ml, so anything above 10 ml will cause an increase in the pressure within that space. So that's why it is so important for any head trauma or any injuries at all, that we have to monitor the intracranial pressure, because a slight change in that pressure can cause serious damages. So some variety of conditions that can cause an increase in intracranial pressure. Again, meningitis, it can be either bacterial or viral. It has to be treated promptly. If it is not, it can lead to damage. Again, any head injury, brain tumor, brain abscess, hemorrhage, stroke, hydrocephalus. So again, any increase in fluid in that area, any inflammation goes on in that area, it is gonna cause an elevated in the pressure in that area, because again, that space cannot be expanded. So other conditions you can look out for that may cause an increase in intracranial pressure is like clients with high fever, nuchal rigidity, that means meningitis, motor vehicle accident, traumatic brain injury. Again, if you had a blunt force to your head, if someone hit you with a bat, if you fell and hit your head, these things can cause an increase in intracranial pressure. Work-related accidents, so anything at all. If you can think of anything that can cause damage to the head, then it runs the risk of increasing your intracranial pressure. So any situation at all, so just think about it like that. And again, it doesn't have to be a really hard hit, but once the inflammatory process begins in this enclosed area, it will cause an increase in intracranial pressure. So some signs and symptoms that you can look out for if a person is experiencing increased intracranial pressure includes headache, nausea, vomiting, altered level of consciousness. You have drowsiness, they're agitated, they get reckless, they lose their judgment. One important thing, the Cushing triad. They're gonna have an increase in blood pressure, a decrease in pulse, and a decrease in respiration. So again, the Cushing triad, they're going to have an increase in blood pressure, a decrease in pulse, and a decrease in respiration. These three are the most important to look out for. And again, an easy way to look out for, memorize it, it is opposite of shock. So in shock, you know that you have your decreased blood pressure, increased pulse, increased respiration. It's the Cushing triads is the opposite of shock. So you're going to have your increased blood pressure, your decreased pulse, and your decreased respiration. Alright, so again, with increased intracranial pressure, one of the early signs is change in mental status. Alright, so you're usually alert and oriented. Now you have probably short-term memory loss, you are confused, you can't formulate your sentences properly. Then think increased intracranial pressure. Other things you can look out for is signs within the eye region. So they might develop papil edema, impaired eye movement. So you're trying to tell them follow your hand. That's a technique that we use to check eye acuity, or visual acuity. So if they can't follow your hand, or if they have just impulsive or involuntary eye movement, then you can think of increased intracranial pressure. For infants, if you notice that they have a bulging fontanelle, again, if they have a bulging fontanelle, you know that they have an increased intracranial pressure. Also, you may notice that an increased size in their head circumference. So for the children, it's a little bit different because their fontanelles aren't closed as yet. They might have an expansion in their heads. So you can note an increased size in the head per se. Also, high-pitched cry, that is a classic sign in infants. If they have a high-pitched cry, think of increased intracranial pressure. Now, for adults and posturing, if they develop decorticate or decerebrate posturing, you definitely know that they have some form of neurological damage going on. So think increased intracranial pressure. So for decorticate, if they are flexed, so if they have a flexed position, then you know that they are experiencing decorticate. Decerebrate is more of a straight position. So I will tag two photos right here so you guys can see the difference. So again, decorticate to the core, decerebrate, straight. All right, that's the easy way to remember it. Also, importantly, if there is a positive Babinski reflex in an adult, you definitely know that there is damage going on in the brain. So the Babinski reflex, when you stroke the sole of a child's feet, then the toes usually fan out. So in adults, they should never fan out. They should actually curl up. So if you notice that whenever you do this at the bottom of an adult feet and the toes fan out, then you definitely know that there is a neurological damage going on. So again, Babinski reflex, it usually goes away about age 12 months. Sometimes longer in different children, but usually about 12 months. So this should not be positive in an adult. If it is positive in an adult, you know that there is some neurological changes going on. So some diagnostic tests, you definitely want to obtain a history from the patient. You definitely want to do a magnetic resonance imaging study. CT scan, EKG, definitely you want to check the intracranial pressure. So these are some things that some diagnostic testing you would carry out in order to see if the symptoms the signs and symptoms that they are experiencing is a cause of an increase in intracranial pressure. So the normal intracranial pressure is 1 to 15 millimeters of mercury. Again, the normal intracranial pressure is 1 to 15 millimeters of mercury. So if it is higher than this, we know there is a problem. Again, it can be slightly off depending on person. Everyone is unique in their own way. So definitely you would, of course, check to see if they're having any neurological changes or anything. But again, the typical or the normal reference range is 1 to 15. So some assessments that we would do for a patient who is exhibiting signs of increased intracranial pressure. Again, you definitely want to obtain a history. You definitely want to know if they're intoxicated, if they have been using alcohol, if they have been using any other substances, in order to find out, are they really having an increase in intracranial pressure, or are they just high or intoxicated. You definitely want to do a memory assessment. Do they have amnesia before or after the accident? If they have been going through their entire life experiencing amnesia, then after an accident, that would not be a good assessment tool to use, whether if they're getting worse or not, because it was present before the accident. You definitely want to obtain their ABGs. You want to know if they are perfusing properly. You definitely want to check their electrolytes, because electrolytes imbalance can also cause impairment in their neurological function. So these are some things you definitely want to assess for. Also, check bun and creatinine. You know that if there is urea building up in the blood, then that can also cause an impair in mental status or change in level of consciousness. So definitely you want to check all these lab values. Again, you definitely would want to check your intracranial pressure also, but these are other things that you might want to check in order to, eliminate out the different causes that the patient may experience in an increase in intracranial pressure. So what are some pharmacological treatment that may be used in order to combat or try to correct an increase in intracranial pressure? The first one is mannitol. Mannitol is an osmotic diuretic. So basically, you want to lose the extra fluid, extra buildup of any sort that's going on in the body. So you would give a person mannitol. The next one is corticosteroid. Corticosteroid helps to combat inflammation and the inflammatory response. So you would definitely give a corticosteroid. Anticonvulsants, all right? So with anticonvulsants, because there's a pressure buildup in the head, you run the risk of having a seizure. So you definitely would want to give an anticonvulsant in order to prevent a seizure from occurring. You want to give a stool softener. Remember, if you are bearing down or if you're straining to go to the bathroom, then it will cause it will cause an increase in the intracranial pressure, because normally when you use the bathroom, it does slightly change the pressure within your within your cranium. So if a person is already experiencing an increase in intracranial pressure, you definitely don't want them to be straining at all. Also, whenever they're blowing their nose, if they have to blow their nose, it is not recommended. You have to blow one nostril at a time, and if they're coughing, if they're sneezing, encourage them to do it with their mouth open, and this will help to prevent a drastic change in their intracranial pressure. Antihypertensive, calcium channel blocker. So you want to basically dilate the veins so that it can decrease the pressure buildup within the vessels. You would also want to do an electrolyte replacement. If they have an imbalance in electrolyte, you want to correct this, because again, it can cause neurological changes if your electrolytes are off balance. Alright, again, whenever you implement these interventions for the patient, you definitely want to make sure they are on continuous monitoring. Monitor their respiratory status, their neurological status, their vital signs. These are very important. Also, monitor their perla. Is their pupil equal, round, reactive to light, and accommodation? Because again, if you have an increase in intracranial pressure, they can have involuntary eye movement. So you definitely want to monitor this. So some other interventions, you definitely want to identify and correct the underlying problem. Keep the head in a neutral position. Again, keep the head in a neutral position. Raise the head of the bed about 30 to 45 degrees angle. So, what I mean by neutral position, let the patient sit at a 30 to 45 degrees angle, and do not let them lean to the left, lean to the right, move their head from left to right, because this movement can cause an increase in intracranial pressure. And again, you would sit the patient up. Remember this, you would sit the patient up, because laying them supine or laying them, say for instance, Trendelenburg, this will increase blood flow to the brain, and this will cause an even bigger increase in their intracranial pressure. So again, you want to sit them up, keep their head midline and in a neutral position. Airway patency, make sure that they're breathing correctly. Seizure precautions, make sure you have all your seizure equipment, precaution equipment, padded bed rails. Make sure you have your oxygen. Make sure you have, your oral suction at the bedside. Remember this. remember this, it is important. Remember that we do not put anything in the mouth of the patient when they're experiencing seizure. So, should you put a tongue blade when they're experiencing seizure? No, because this can compromise their airway. Alright, so we're gonna, implement our seizure precautions. Maintain body temperature. You don't want the body temperature to increase too much or decrease, and too drastic of an increase in temperature can lead to an increase in intracranial pressure. Safety precaution as usual. Emotional support. The patient, may be experiencing a lot of emotions. You definitely want to keep this patient calm, because emotions going all over the place can also change the intracranial pressure. So you definitely want to offer emotional support. Other interventions, you want to limit the amount of fluid and do an accurate intake and output on the patient, because you don't want them to be retaining any extra fluid when they have an increased intracranial pressure. Alright? Prepare for surgery if indicated. Also, a quick tip: if someone has a increase in intracranial pressure, an increase in ICP, you never ever want to do a lumbar puncture per se. Again, you will never ever do a lumbar puncture. There might be one or two instances where there is a need, where the outcome outweighs the end result. So, but in general, do not do a procedure just like a lumbar puncture, because it will cause brain herniation. That means the fluid has a way to escape, so with the fluid it's going to pull also the brain, so it will herniate the brain and it will cause permanent damage. So do not, I repeat, do not do a lumbar puncture on a patient who has an increase in ICP. With the elderly population, you definitely want to look out for the typical signs that they may exhibit, like confusion or lethargy, different from their increase in intracranial pressure. So you definitely want to have a baseline of that patient. Some goals of the treatments that are being implemented is to definitely maintain airway, breathing, circulation, maintain cerebral perfusion, because remember, once brain cells are damaged and destroyed, they cannot be regenerated. You definitely want to, reduce intracranial pressure, and also keep in mind you have to do this process slowly. Again, you have to do this process slowly. Maintain cognitive function and prevent complications. At the end goal of everything is that we return them to their optimal state. Again, return them to their optimal state. So we are going to implement all these things in order for them to reach this goal. So the big takeaway from this video is that we want to maintain their neurological function. Again, maintaining their neurological function. So we're going to do everything in order to preserve their neural function. So again, thank you guys for watching this video. I hope that it was helpful. And if you have any questions, concerns, any comments at all, leave it down in the comments below. Again, thanks for watching. Please like, share, comment, and subscribe. And as usual, all the best and good luck.